talking to coronavirus, and we're seeing the infection rate here in South Africa now number 7. South Africa is number 7 in the world with regard to coronavirus cases. The country has recorded a total of 638,517 infections, of which more than 560,000 people have already recovered. Unfortunately, more than 14,800 people have died. They've lost their lives from COVID-19 related illnesses. And at this point in time, as you and I talk, we have 59,737 active cases in South Africa. So with all of those facts out of the way, let's get to the issues that we can talk to the Minister about. Joining us, Health Minister Dr. Zweli Mkhize. So nice to see you, Minister. Thanks for joining us.
Good morning, Leanne. Good morning, Sakina. Good morning to all the viewers.
So this is quite a jump since we last spoke in terms of that downward trajectory we find ourselves on as a country. Let's talk about it. Is this what you expected, to be seeing such a dip right now in the infection rate?
Well, the difficult thing with COVID-19 was that you never actually knew what to expect. And the reality is that we can now safely say that we are over the surge, and that throughout all the provinces in the country, the numbers are reducing, and we've come to a point where there were days when we used to have about 11,000 people were positive, but for today we are now around 2,000, sometimes less, very close to 1,000. Now that for us is an indication that what we are seeing, the reduction of the numbers of people who are hospitalized is real. The fact that our ICUs are not so full, the numbers of people who are in the various hospitals who are coming through needing assistance are not showing the kind of pressure that we used to get. So that's already indicating to us that the numbers are reducing. We're not over the worst yet. I think the situation is that we're worrying about what may happen in terms of the resurgence into the country. You have already noticed the issue of South Africa being number 5 in the world. It's now been reduced to number 7. And in fact, in another week, if the same trends continue, we're likely to be around number 8. Now, that tells us two things. One, South Africa's positive cases are reducing. But secondly, that the infection is still growing in the rest of the world. So we are still at risk as well.
Certainly. I mean, we saw what happened in India. This was yesterday, I think. It was close on, I hope I don't get the figure wrong, but something like 90,000 infections in a day. These are, and we'd always seen their infection rate also not too bad, but it now seems to be going higher. So we're nowhere near out of the woods. Can I interpret that into what you're saying?
That is correct. What we are saying is that we are fortunate that the numbers are not increasing. Maybe our containment measures are helping us, but maybe there might be other factors. But I think to the extent to which our own containment measures are important, we need to keep to those. It's important for us to say we expected the numbers could have gone higher when we move from level 3 to level 2 with more mixing of people, more opening up of various aspects of the economy and social activities. It hasn't happened. So we're hoping, therefore, that we should be looking at how to start looking at further easing additional restrictions so that over the next few months, we should really try and get back to normal with a new normal, which is using masks everywhere, distancing and so on. So we really remain very hopeful.
I want to read a bit into what you said. Let's get back to normal, because a lot of people are asking for that, and not that you're in charge of deciding what opens, what closes, but obviously you are one of the decision makers. We're seeing so many sectors of the country and the economy still wanting to go back to normal, i.e. having events, getting concerts going, having more people being able to gather together, perhaps even open borders, allow international tourists, these kind of things, 100% capacity. Are we there yet? Is this something we can expect soon?
No, we're not there yet. And I think it's important to say distancing is going to be important. We're going to have to look at mechanisms of how, even if we were to increase the numbers of people, but you must ensure that the distance is sorted. That's why we're saying not more than 50 people, not more than in accommodation, hotel accommodation, or not more than 50% of the capacity. All of these issues are issues that we're going to keep refining as we move on. I think it's important to say we will learn as things happen, and therefore we'll need to move step by step as we try and return to normality. We're not ready to open up everything just like that, but we also don't think that we can contain all the restrictions forever. We think that they need to be eased as we move along. As to when that happens, of course, that proper decisions have to be taken on that.
Mm. A lot of people still also questioning the testing numbers because they're saying, obviously, the more you test, the more you find. The less you test, the less you find. And we're seeing that the amount of tests being done in South Africa have dropped dramatically, and that the numbers are there. They're very transparent to see, and they're released every single day. Let's talk to that, the testing numbers, and why they've dropped so much, and why we are not actively looking for cases anymore.
Do you remember the time in June when we were all being castigated as being testing too much? We must drop some of these tests and we must not test so many people, because it was felt that we tested too many people. But actually what had happened is that we went on to a community testing where we went out, looked for people who had symptoms or who, out in the communities, and we tested them. The numbers were high, but in the process, we then refined the strategy and decided that we were going to test those, those who are presenting with symptoms in the hospital. The number was huge. Those were contacts and those were vulnerable, these comorbidities and so on. We kept to that category of people. It's them who have reduced. It's those people who have become fewer. So one day when I looked at the numbers and I was very worried, I sent a message to all the professors in the country and I said, listen, why are we not seeing enough tests? Are we missing something? They came back, they said, well, we don't have the patients to test anymore. There are fewer and fewer people to test under the category. So in reality, we do need to still increase the numbers of people to be tested as part of our surveillance. But the numbers that we've got have actually had a very significant issue in them. And that is the positive case rate was about 27 to 30%. So every 100 people, you would find that 27 to 30% were positive. Today, for every 100 people, you are finding about 11 people who are positive, which means for every batch that we take, the same people that we're testing all along are now reduced in terms of how many of them are positive. But when you see the trend in the community, in the hospital, you know you are correct. So the people mustn't worry about it. Nevertheless, we still want to increase change the criteria to test more people. It's really more for surveillance, not because we're actually saying the testing of our numbers is influencing the numbers of positive that we're seeing.
Yeah. Also the death rate. So we see the death toll sitting in South Africa at, what are we at now, Minister? Remind me of the number. I've read it so many times. It's usually on the side.
14,889.
Thank you.
14,889 at 2.3%.
Okay. So a lot of people are looking at the excess deaths and trying to find about 40,000 excess deaths and the causes behind that. Where are we at right now with regard to that?
Well, the numbers we go by is the 14,889. That's what we record as COVID-related deaths. Then we do a separate process, which gives us a number of what we call excess deaths. Now, excess deaths are not all COVID deaths. They are COVID, there are deaths during COVID, which means there could be people who are COVID positive, but a number of them would be people who have no COVID infection but may not have gone to the hospital for various reasons. What we have seen with these trends is that these numbers tracked the surge in our numbers of positive cases. When our numbers were very high, the excess deaths were very high. When the numbers of positive cases were reducing, even the numbers of excess deaths were also reducing, which means we're keeping a good track of the excess deaths. Of course, the unnatural deaths during the lockdown, they decreased drastically. And when we reopened alcohol use, and then they started increasing again, in the past few weeks, they've also started increasing. The increase there is associated with the just easing of the alcohol because of the extra, violence and car accidents and so on. But those are not a factor in the numbers that we're looking at. So even as we track the excess deaths, we are not worried that we have missed so much. We have got a sense of how much deaths are recorded. But COVID deaths are at 2.3%, and that figure is how everybody else is calculating it in the world.
Why? I ask this question because I think a lot of people are also thinking the same thing. We look at other countries. Now, we were in the top 5. We've now gone down to the top 7, as you yourself have said, in terms of the infection rate. We have an 88% recovery rate. We have such a low, comparatively, fatality rate according to the rest, if we compare to the rest of the world. Why? So many people asking this question. Is there something out there that we're perhaps... I don't know. Is it a different strain that we have? Are we a younger nation? Some people are saying that. I mean, there are a whole bunch of theories out there. So I ask you, the Minister, why? Why is it like this?
You know, what's interesting for me is how so many people are interested in the intricacies of virology and clinical manifestations of pandemics. It's very exciting stuff. We have no idea what's happening. Firstly, I think we must feel happy that we're very fortunate that this is where we are. But now, if you look at how the deaths have happened in the other countries, we're not quite seeing what the other countries have seen. Is there a reason for it? There are things which we did right. Early lockdown, we believe it was important. An early institution of use of masks and containment measures, we think those were very important. But now, we think that there are issues which the science must still explain to us. One, there's an issue of immunity. We're getting studies now to try and check how much immunity has gone in, because it would appear that there have been a number of people who have been infected who have never shown any symptoms. And so how many of those are such that the virus is no longer able to spread fast? We don't know. It's an open question. We're looking into that aspect. Then the issue of the climatic changes, climatic conditions. There have been research that was done that was simulating saliva, virus in saliva, where they were actually looking at how long it takes for the virus to survive in sunlight. And so in sunlight, it was about 7 minutes. In darkness, it was about 24 hours or more. And therefore, there might be a factor. We don't know. And then there's an issue of the demography, the youth demographics, where you've got the largest number of population being younger people. Whether in fact that's a case or not, we don't know, but we believe therefore that that's one thing, because as you can see, the mortality rate has been higher in many countries. It's largely as you go beyond 40, 45, certainly 60, 70, the numbers go higher. So that might be a factor, we're not quite sure. Whether there's a different strain altogether, it has not been identified. So it's a very interesting area of science that we will only find out once we're out of this situation we're in, because things are moving so fast. This virus has only been with us in South Africa for 6 months. In the rest of the world, it's hardly a year. And therefore, in fact, it's about 9 months or so for the whole rest of the world. So it's very difficult to know everything about it within such a short space of time. We're looking forward to vaccines. We don't know how well they work. We've already started tracking a few individuals who are reporting reinfection. What is the case there? We don't know. Which type of immunity they get when they get infection and when they get reinfection, nobody knows. What level of viral load is needed for someone to develop so much of immunity or even to get a reinfection? We don't know. So all of these issues, you're at a point where all the scientists will say, we don't know yet. Yeah. That's the answer.
And a long answer at that, because it's still all question marks and one wondering where, how and what.
That's why I say it's interesting.
Exactly, it is very interesting.
It's very interesting.
Hopefully we'll get more scientists to come out of all of this and wanting to go in that direction. There was a very controversial article, and I think it was perhaps not so much the article but the headline. The BBC ran this one. I know you must have seen it. The headline, they've since removed it, but what they basically said in this was coronavirus in Africa, could poverty explain mystery of low death rate? I'm sure you saw that one, Minister. They subsequently changed that and very quickly into something completely different, trying to find the death rate, but also saying that maybe there were already existing kinds of strains of coronavirus within people that live in close proximity to one another, and this could explain why it hasn't actually affected us so much. Is there any truth to that? What do you think of that theory?
Well, it's difficult. We have a problem being in Africa. When we had no infection, the accusation was we didn't count, we didn't know how to find the virus. When we found the virus, everybody says we're going to be the West. We were not the West. When the virus came, then it was said we don't have enough equipment, we don't have good enough health services, we don't even have enough scientists, so it's going to be worse, and it didn't quite become. Then it was said, well, you're not calculating properly. Then we actually tested. Right now, 3.8 million tests have been done in South Africa. You really can't say that we can fail to find if there was something. So the reality is that some people started saying that there must have been a BCG cross-reaction. We don't know. It's never been proven. Others were saying that there may well be other coronavirus-related kind of strains. We don't know, because if there were those strains, how come we didn't find them immediately? We started having coronavirus. How come the numbers only started increasing as our infection rate increased? So could that be true? I don't know. I doubt it. So there are all sorts of questions that are being raised. Could the climate be an issue around it? I don't know, because if you looked at our own situation, I asked the question, how come you got an issue of a death rate that is different in the Western Cape and then in the Gauteng? Others said, well, maybe altitude, maybe atmospheric pressure, humidity, etc., and level of oxygen in this thing. But it was not the same between Durban and Western Cape. So that disproves that. So everything here is really at a point where you basically got a melting point of theoretical considerations that have to be proven, and that will be in time. And at this moment, I think it's good to read everything that's going out there. I think for me, the most important thing right now is to say, at the beginning, we were also saying we wanted to try and chart our own path where we try and save as many South Africans as possible, and we try and make sure that we learn as much and teach the world from our own lessons and learn from the world as much as they can teach us. So I think we're going in that direction.
Yeah. Minister, we're in our headline time, but I know that this is our key headline, the numbers and following this one. So I'll ask you one final question just to wrap this up. I know you spoke opening borders is too soon, so that we won't possibly see that happening right now. But the reality is that there is the risk of a second surge, and we have seen this taking place in other countries as well. But we were also told when we moved into Level 2, schools reopened, restaurants, bars, everything had reopened, and yet we haven't seen a surge in terms of infection cases. So this second surge, is it going to happen according to predictions? Will it come?
Well, we say we've seen it happen in other countries. They had the first infections, then they started shooting up the numbers and having deaths. We're the same thing. We've seen other countries have gone up with their second surge. So it's possible with us. Doesn't have to happen. We can't actually contain it. My view is South Africans must believe in their capacity to prevent a second surge. That's what should be the answer. Should not be a prediction. Should be because we're determined to stop the second surge.
Minister, we leave it there. Always a pleasure having you on the programme. Thank you for talking to us. That's our Health Minister, Dr. Zweli Mkhize, giving us the latest update on the COVID-19 pandemic in South Africa. That, of course, is also in our news headline.